is Jasmine. I'm a student nurse. Today we're going to be talking about foot care for diabetics. To start off, we're going to be talking about why is foot care important. If you have diabetes, nerve damage, circulation problems, and infections can lead to serious foot problems. Diabetes can damage your nerves and reduce blood flow, and managing your diabetes and maintaining a healthy lifestyle can reduce the risk of foot complications. Some of the foot complications, early signs that should be reported to the provider would be feeling of burning, tingling, or pain in the feet. Normally that's caused by neuropathy, which is nerve damage in the feet. Also, if you're feeling any loss of sensation to heat, cold, or touch in the foot, changes to the color or shape of your feet. Also, if you're losing hair on your toes, feet, and lower legs, thickening and yellowing of the toenails, and onset of red spots, blisters, sores, ulcers, infected cords, or ingrown hairs should be reported to the provider for further caring. A serious infection that can lead to serious problems and amputation of the foot is gangrene. In this picture, it shows a black foot. Gangrene is an infection that it does not heal. The only way to take that away is to amputate the foot or maybe surgery. Also, this is dead skin and tissue, normally caused by necrotic tissues. Further on, we're going to be talking about daily foot care for your daily life. Things you should do every day just to reduce the risk of any complications of the feet, including inspecting your feet. You should always check your feet, toes, soles, every part of your feet. If you're physically unable to view your own feet, you can use a mirror or ask someone to help view them. Contact your doctor immediately if you're experiencing any sores, redness, cuts, blisters, or bruises. Second, wash your feet. Wash every day with warm water and mild soap. Please do not use hot water or harsh soap. Diabetic feet are very sensitive. Check the water temperature with your finger before putting your feet in. Number 3 is dry your feet. You should always pat and dry your feet between your toes as well. This moist in your feet can cause fungus and very harmful bacteria. Also, moisturize your dry skin. You should never leave your skin dry because that cracks your toes and your feet. Always use lotion or oil so your feet can feel free from rough and dryness. Do not use lotion between your toes. Very important. Also, we're going to be talking about some footwear, shoes, and socks that can be used to prevent any complication for a diabetic foot. Choose comfortable, well-fitting shoes with plenty of room. Never use tight shoes. If you think you're buying a pair of tight shoes and you're going to fit them in, they're going to stretch out, you should always avoid tight shoes. Also, do not wear shoes made out of plastic or other materials that you cannot breathe in. Shoes that are recommended for diabetics are kind of like leather and canvas shoes. Avoid thong sandals, flip-flops, pointed shoes, open-toe shoes, and very high heels. Also, inspect the inside of your shoes every day for tears or bumps. If you have nerve damage, give your feet a break or change shoes after 5 hours. Socks can provide an extra layer of soft protection between your foot and your shoe. This is a good way because being barefoot, especially around your house, can provide a lot of bacteria, ulcers, and sores. So if you like to walk around barefoot, might as well just use socks. Wear clean, dry socks or non-binding pantyhose. Never wear socks that are too tight or pantyhose that are too tight that can cut your circulation down your feet. Also, wear socks to bed if your feet are feeling cold. Very important. Some healthy foot habits to keep in mind. Antiseptic solutions can burn your skin. Never use them on your feet without your doctor's approval. This should be something that should be prescribed by the provider. Secondly, never use a heating pad, hot water bottle, or electric blanket on your feet. Most people know how to avoid hot payments or sandy feet. However, like I said before, walking barefoot around the house can cause sores or injuries that can get infected. Avoid walking barefoot. Don't try to remove warts, foot lesions yourself, that's something that needs to be done by the doctor. You can see a doctor or a podiatrist. Don't stay with your legs crossed or stand in one position for long periods of time. Also, very important, you need to take care of the nails. The nails on the toes are very important. You need to trim the nails a certain way. You should cut them across rather than a curved fashion to help prevent ingrown toenails. Don't cut into the corners. Use an empty board to smooth the edges. Be careful not to cut your toenails too short. Have your toenails trimmed by a foot doctor or another healthcare provider. And some healthy diet foods that we can to reduce the risk are vegetables, whole grain, fruits, beans, lean meats, poultry, and fish. And to wrap it up, these are some pictures of foot complications that can occur for a diabetic who have uncontrolled diabetes, for example, foot ulcers. And these are gangrene. The gangrene infection that needs to be very treated severely. Also, these are just steps to for daily care. For example, wash your feet daily, dry your feet, keep the skin supple. Check your feet, like I said. Also change daily for clean stockings. Never use too tight socks. If you keep your feet warm and dry, never walk barefoot, and examine your shoes every day. Make sure there's no pebbles, rocks in there that can infect your toes. So this wraps up my presentation about foot care for diabetics. Thank you for watching.